What I wish the medical doctors would tell their patients is after you've diagnosed and prescribed and gotten them stable with the medications, whether that's blood sugar, blood pressure, cholesterol meds, probably the three most common for the diabetics, is to shift gears and give the respect and the importance it is about changing their lifestyle, changing their diet. I know that's not the medical world's job to do that. They're not really set up to give that coaching and advice, but at least give it some credence or at least refer them out of just pharmaceuticals only. Unfortunately, too many medical doctors downplay how powerful some of these lifestyle and dietary changes can be. And unfortunately, too, they'll say, hey, when your numbers go up or you're about to eat more carbs, just increase your medication, or here's a sliding scale of medication. So they really get diabetics to think about meds first. Numbers high, take more. Numbers low, take less. Instead of thinking about health first. Now, don't get me wrong. In crisis and emergency numbers 3, 4, 500 dangerous levels, of course we want to talk about getting them stable with the medication. However, once they're stable, there's no shift that goes on here. So that would be probably number one is once they're medically stable, either send them out, refer them out, or tell them how important it is to make these dietary changes and lifestyle changes, especially when you see your patients going up with more and more medications over time. The second thing that is extremely important for patients to hear, especially from their medical staff, is to not lose hope, is to know that reversing or at least drastically improving the state of their diabetes and doing it naturally is absolutely possible. There's so many patients that I work with where their medical doctors or their medical team has completely downplayed some of these strategies, and the patient doesn't know who to trust. They see success stories online, and then their doctor's saying, well, none of that's for real, or it's not going to last, or it's not possible. So when you lose hope, when you don't believe anything's possible, and we just accept what the medical doctors say to us as absolute truth with a capital T, it really puts people in a bad spot. It backs them up into a corner. And if, again, if they don't think anything's possible, they're not even going to go search for it. They're not even going to try because hook, line, and sinker, they believe nothing else is possible. So I guess I'll just take the meds. They'll try diets and dabble at it. But at the end of the day, if they believe that it's not really going to make a big difference, they slack off or they take it easy or they just don't realize how damaging it truly is to continue not making the lifestyle and dietary changes. It's almost like if you were an alcoholic and instead of the doctors telling you to stop drinking alcohol and give you tools or put you in programs to help you do that, it's kind of like, well, just watch out for it. Get a little exercise. If you're going to drink alcohol, just drink a little bit less of it. We all know that if we told that to an alcoholic, it would just spiral them out and set them up for way too many situations where they're going to get worse and worse and worse. Some of these things, some of these mindsets, I wish that they would share with type 2 diabetics. And unfortunately, I don't hear a lot of stories from my patients where they're getting that type of information. In fact, a lot of the information that they get is discouraging them from going and attempting, searching for, and trying other approaches outside the pharmaceutical space.